Hi, my name's Cameron McIntosh. I'm an ENT surgeon and a board-certified facial plastic surgeon. So the EarWell is a new technology which has really revolutionized protruding ears. The entire philosophy behind it is completely different to, in the olden days, we used to wait for a child to be 5 or 6 years old and take them to surgery and do an operation to try and have a good outcome. What's now the greatest and latest way of doing it is as soon as that baby's born, we will assess the child and see, according to what their ears look like, if we need to put a special silicone mold glued onto their ears for 2 weeks. And in those 2 weeks, whilst the child's hormones have changed so much and the ears are getting into their normal position, that mold assists us in being able to have a normal looking ear. The mold comes off and then we've done. So the great advantage is the child does not have to wait until they're 5 or 6 years old with all the emotional trauma that goes with it. The outcomes are far more superior. There's no pain involved. There's no surgical risks involved. So an EarWell is one of the greatest inventions that's come out of America in the last 30 years. So if as a parent you're concerned that your child may have deformed ears, you are welcome to reach out to us. There are a few things we do. Obviously, we're firstly going to assess the child. We're going to find out if there's a family history of strange looking ears. And then what's really nice is a small little pen that has been designed by EarWell where you have 3 colors and we can measure according to the length of how far the pinna is away from the skull if we know it's a safe area, a caution area, or a treat area. And obviously if the child it falls within the red zone, we're going to treat them and we're going to put EarWells on for them. So one of the single most important things about the EarWell is it needs to be put on the baby's ears within the first 2 weeks of being born. The crucial part is in those 2 weeks is when the hormones change, and after 2 weeks the cartilage will not be very moldable. So you need to get an EarWell on within the first 2 weeks. Otherwise you're going to have to wait for surgery at the age of 5, 6 or 7 years old.